the courses, because I know you are passionate about mostly the healthcare courses, and mostly which ones you'd advise anybody to pursue. I know these sometimes are very emotional topic because you touch people's courses in a bad way. They say you're talking that way because you are nurse.
Yeah, and they also feel like my brain is not enough for me to be able to be talking about professions of bright people. So I understand. I completely understand. It would be very touchy for someone to come and tell you what you did or what you're doing is not what they would recommend. So that reaction is something I completely understand. I do not go to sleep thinking that these people are crazy or something. I go to sleep thinking that you rubbed someone where it hurts, and it is not my intention. But I really feel bad when I see parents, especially, taking their children to school, promise that immediately after you leave this, once you take this course, it is settled. It's guaranteed. You're going to have a job. You're going to get out and get a good salary. Then I realized that is not the case. And I think I'm on record saying what I recommend and what I don't recommend, because I don't shy away from that. But I also say that this is me. You can choose whatever it is that you want to do. I am not going to tell you don't do it. But I interact on daily basis. I interact with a lot of health workers. And I do recommend nursing. Only because of one thing. The local market may not absorb everybody, but there is a chance that a nurse can be absorbed more than any other cadre because of the demands of the health system. We have trained many nurses here in Kenya more than we need, and we have nurses earning deplorable salaries, to say the least. But also there is a recourse. You can go to US, you can go to Canada, you can go to Germany, you can go to Australia. There is that path that you have a chance that you can leave and go to another country. And I think, I don't know of any other profession, especially for the US, that is giving people a work permit pathway to US apart from nursing in the medical courses at this point. So that one, for only that one reason, I recommend nursing. And I tell people, if you're going to school to do your nursing to come out here and practice, you will be frustrated. But if you're doing it to leave the country, then there is that pathway. I do not recommend clinical medicine, and I am on record on that. People have called me all names about it. And it's not like I don't know, I have a family member who is a clinical officer. And I tell him, oh yes, and I tell him exactly that. Why? Because I feel the government has refused to give clinical officers a pathway to advancement of meaningful education. In this manner, you are taking a diploma in clinical medicine, and then you take a degree in clinical medicine, and then you take a master's in clinical medicine, and whatever PhD in clinical medicine. Then when you come to the health workforce, where do you lie? Do you understand? Because there is a doctor, there is a consultant, there is a what? If you have a degree in clinical medicine, where do you lie in that kind? How does it change your scope of practice? I am yet to be convinced about that. However, I recommend that the government should provide clinical officers with a pathway to become doctors without having to start scratch. If they can be given credit transfers, because clinical officers are largely doctors, they have studied over 60% of what doctors
do. That's
so
true.
I want the government to sit down and say, these people have studied this much, and whatever is remaining is this much. And then they're given like 2 years or 3 years to go ahead and just finish what they didn't do. And then they become doctor. And that cadre, for me, it will be a clear pathway. Number two, I don't think clinical medicine gives you a pathway to international jobs. In this manner, it is a cadre that is really largely in East Africa. And so today, if you are to board a plane and go to the US as a clinical officer, it will take you going back to school for you to practice as a health worker. Because you cannot apply for licensing directly. And that happens to you, Australia, Canada, anywhere you go. You will need someone to start afresh. So for me, I don't find it like a globally acceptable cadre. Number three, here in Kenya, we have trained more than we can absorb. That's for sure. Because I remember when I went to college, in my class, nursing class, it was 40 students. And when we got to 40, they stopped taking any, people were returned back home. Why? Because then Nursing Council was only licensing a limited number of nurses. In the class of clinical officers that time, there were over 100 students in one go, in one MTC.
That's a very big number.
Yeah, and all around the country, everybody was training clinical officers, and then you release them to the
job market.
With a limited scope of practice, and you let them look for jobs. I know people will really come at me about this, but I wish people can speak directly to people who have qualified as clinical officers everywhere, and they will tell you the struggle they have gone through even to be able to start. I know people say you can start a clinic, which is okay. You can start a clinic, but how many clinics can we start if all clinical officers, they're aiming to start a clinic in somewhere? And starting a clinic, someone commented today on my video that starting a clinic would cost you 500,000. How many people are coming out of the school with 500,000? You will need to raise that 500,000. And will you raise 500,000 with a salary of 35, 40,000? It is not easy. So when I say I don't recommend, I'm not telling them to leave it so that I can take it for sure. I'm telling them because I am here. I am a decent human being and a student of history and a person who walks around and speaks to people. And I know that when you get out of here with clinical medicine as a course, you might have a bigger struggle.
And right now,
go ahead.
And right now, Wairimu, there is another course which I've seen colleges offering, which is called perioperative theater technology. And I've seen many private colleges offering that course at a basic level. How will those people be?
They got me into trouble when I talked about it.
Yes, I saw that video.
Yeah, they got me into trouble because this is my question. I do not dispute that perioperative theater technology is a skill that is valuable to the health system. But again, there is a specialty for nurses for perioperative theater technology. So nurses are taking it as a specialty. Over the years, for me, even when I was training, there was no much of perioperative theater technology on day-to-day running of the theater. Much of it was being done. They were working much in the CSSD, managing the instruments and all that and all that. In one hospital, you will find like they have employed 2. In a district hospital, for me, I trained in a provincial hospital, and they were less than 5. And they were not really trained perioperative theater technologists people. They were people who have been in theater for a long time, and they have been trained on job on how to do it. And then this was introduced. Let us even assume that they continue training. If one hospital, major hospital, can take, let's say, 10, what will happen to all the other people who are trained with this course, and they're supposed to work in this one specific department, very specific. They're supposed to work in a major theater. How many major theaters do we have that are going to assimilate all the people that we are training? And number 2, if you are the one who has a hospital, there is a nurse with a specialty in perioperative theater technology, and there is this one person who has done perioperative theater technology. Who do you employ? You employ a person who can do left and right, who can do more than one thing. And I think that is a reality in any business. So my only issue is that you can train all these people, but once they get out here, it will not be easy. Because they have this one specific department they are working in. They have competition from the specialized nurses. And number 3, we do not even have enough theaters in this country to take them in. And they do not have a pathway for a global, international kind of jobs.
Yes.
Yeah.
That would be a challenge because there are so many, and the colleges are cashing in on that because they know people don't know.
Because colleges are in business, and they will do anything. And there is a fascination out there of people hearing theater. When they hear theater, they think it's a very sophisticated thing. I will be working in theater. I don't know whether people think working in theater makes you a surgeon or something, but the truth is that if your playground is only a major theater, then your playground is very small. And if 100 people are trained and they are released, just even assume they are released into Nairobi might not be even able to assimilate them.
That's true.